So dear students, today we are going to start with the antiamoebic agents. Antiamoebic agents are those agents which are used to treat amoebiasis. Amoebiasis is the causative agent for the amoebiasis is Entamoeba histolytica. It is a type of amoeba. The structure is drawn on this slide. So what is it? It is a protozoal parasite and which will cause this protozoal disease called as amoebiasis, and it is actually pertaining to tropical areas. And it is you will wonder, it is the third highest cause of death and illness, and it affects nearly 50,000 to 1 lakh deaths a year worldwide. So when we talk about amoebiasis, we usually see that you will take the anti-amoebic drugs and you will be cured of it, but it is not like that. It is amounting to nearly up to 1 lakh deaths per year throughout the world. Okay. So what is this amoeba? Amoeba we have studied since our college days, the junior college days. Like, it is a shapeless mass of protoplasm which is having an ectoplasm, that is the outside cytoplasm, and the inner cytoplasm which is called as a granular endoplasm. It is having food vacuoles and red cells. Okay, the red cells are having the ferrous ions which are required for carrying out the various biochemical processes within the amoeba, and food vacuoles, of course, they provide the nutrition to the amoeba. Now, amoeba can be seen only with a microscope, and it exists in two forms, the cyst form and the trophozoite form. The cyst form, as it is drawn here, you can see that it is somewhat bigger, and okay, it is smaller, actually smaller in size, ranging from zero point 0.1 to zero point 0.2 millimeter, and the diameter or the dimension of the trophozoite form of the parasite is ranging till 0.6 millimeter. And cyst form is the non-invasive form of amoeba, while the trophozoite form is the invasive form of amoeba. Means whatever infection is caused due to the amoeba, it is because of the trophozoite form. Cyst form, it is non-invasive, means the cyst is actually a covering. Cyst म्हणजे काय, एक आवरण. ठीक है. So it is a hard covering, it is a shell in which the amoeba resides. So that is why the cyst form, they are not actually releasing the amoeba particles, and they are the non-invasive forms. This is a life cycle of amoeba. So you can see in the figure, these are the mature cysts which are ingested. अब ये ingest मतलब हम orally लेते हैं, especially when we eat the food which is not fresh. आपण समजा अन्न खातो, शिळं अन्न असेल, किंवा दो दॅट फूड विच एस्पेशली द आउटसाइड फूड, and which is not prepared under hygienic conditions. Okay, the best example is pani puri and all those things. So the mature cysts, they are ingested through these food items, and it will go into the body of that particular patient, and it will actually go to the intestine. Orally जेव्हा तुम्ही कुठलंही फूड घेता, तर पहिले ते काय होतं की it goes through the esophagus into the stomach, that is into the stomach and then the small intestine. So when it goes into the intestine, the lumen of the intestine, you can see this coil tube, okay, of the intestine, and this coil tube of intestine, it is having a mucosal lining. So this particular cyst form of amoeba, or the amoeba whatever are going into the intestine, these will stick to the GI mucosal cells, and it will take the nutrition from the GI mucosal cells. Okay, they will grow there. The amoeba will multiply in the lumen or in the tubule lining of the intestine, and it will grow, it will multiply. And when the patient's immune status is very very poor, समजा immunity खूप कमी है, especially in the immunocompromised patients like diabetic patients, or in cancer patients, or patients with AIDS, and so on. So in these patients, the amoeba will multiply to a significant extent, and it will give the trophozoites. So under the favorable conditions for the amoeba, means during the less immunity status of the patient, the amoeba will multiply, and it will transform into the, it will develop into the trophozoites. These trophozoites are the invasive forms of amoeba, and if the amoeba is not treated at this stage, okay, then what will happen, that amoeba will migrate to the other parts of the body, like it will migrate to the lungs, it will migrate to the kidneys, okay, gallbladder and so on and so forth. So it will migrate to the other parts. This is called as migration or infection of amoeba outside the intestine is called as extraintestinal disease or extraintestinal amoebiasis, and within the intestine it is called as intestinal amoebiasis. Okay. The triangle, the blue triangle with I written is the infective stage. So this is the mature cyst when they are ingested. This belongs to an infective stage. Where D it in the blue triangle it indicates the diagnostic stage. तो यहाँ पे भी डायग्नोस हो सकता है, ठीक है. ओरल कैविटी में भी डायग्नोस हो सकता है. और जब आप when the person defecates, okay, then the feces of that particular person, the stool examination of that particular person, it will also be a diagnostic stage for diagnosis of amoeba. So you can see here, what is this excistation? Excistation is the opening of the cyst under favorable conditions of amoeba or the low immunity status of the patient, and this excistation means the amoeba particles, they will go out of the cyst and they will form the trophozoites. The trophozoites will multiply further into more trophozoites, more in number, or they will be encysted. अब ये ट्रोफोजाइट कब मल्टीप्लाई होगा दूसरे ट्रोफोजाइट में? अंडर द फेवरेबल कंडीशंस ऑफ अमीबा. Okay, but if the trophozoites are present and the particular person is taking drugs, okay, the medicines related to amoeba, then what will happen? Some of the trophozoites, they will be encysted. This is called encysted. Encysted म्हणजे ते trophozoites cyst form मध्ये कन्वर्ट होतील. ते काय? इट इज अ प्रोटेक्शन फॉर द ट्रोफोझॉइट्स. द ट्रोफोझॉइट्स आर बीइंग प्रोटेक्टेड बाय एन्सिस्टिंग देमसेल्स. ओके. एक्सिस्टेशन म्हणजे सिस्टच्या बाहेर निघणं आणि सिस्ट मध्ये जाणं म्हणजे एन्सिस्टेशन. So this encystation can happen, and usually what happens is that usually the adults like you people, when you eat outside food, and if that food is having the cyst of amoeba, then you being an adult, you being in a very good immunity status, then you will take that cyst and the trophozoites will not be formed. तर या कंडिशनमध्ये आपण म्हणतो की तो पेशंट काय असिम्प्टोमॅटिक कॅरियर आहे. म्हणजे तुम्हाला पोट दुखणार नाही, वॉट एव्हर सिम्पटम्स ऑफ अमिबा आर देअर, अमिबियासिस, you will not have, because you are in a very good immune status. So you will not have all the symptoms of amoeba, still you will be a carrier. So this is called as asymptomatic carrier. But whatever stools you will pass, whatever feces are there, if the proper sanitation conditions are not followed, then the cyst will be carried further, and it will be infecting the other patient. Okay, so this is the difference between symptomatic and asymptomatic carrier. Amoebic dysentery means what? The presence of blood or mucus in stools and severe abdominal pain, ulcers, म्हणजे intestine मध्ये ulcers तयार होतात. Okay, so this is one of the biggest symptom of of invasion of amoeba. If it is not treated, then it can lead to amoebic dysentery. Still, if it is not treated, it can lead to amoebic abscess. Amoebic abscesses सुद्धा कॉमन असतात. जे लोक दुर्लक्ष करतात स्वतःच्या खाण्यापिण्याकडे, or the people who are very poor, sanitation conditions are not proper, they are frequently suffering from amoebic dysentery and amoebic abscess. Okay, so what is abscess? In liver, okay, severe it occurs in liver. जेव्हा abscess म्हणतो, it usually occurs in liver. Okay, not exceptionally, पण usually liverच्या related abscesses असतात. The severe symptoms like fever, chills, diarrhea, okay, non-bloody, but still diarrhea is there, means loose motions and all. Then intense stabbing pain in abdomen, that is all related to the amoebiasis. And amoebic abscess means the formation of pus and pus cells and the severe infection of amoeba in liver. Then these are the anti-amoebic drugs classification: luminal amoebicides, luminal trophocytocytes, and systemic amoebicides. Luminal म्हणजे काय? In the GIT. Okay, when the amoeba means the cyst form are present in the lumen of the intestine, the person, as I've told you, will be an asymptomatic carrier. Okay, so diloxanide, furoate, iodoquinol, and pleoquinol, these are the drugs which are used to treat the cyst forms of amoeba in the lumen of intestine. Okay, but if the cyst form of amoeba get existed and they will convert into trophozoites, then we have to take the drugs which are called as luminal trophocytocytes, means they will act against they will kill the trophozoites which are present in the lumen of intestine. Examples are metronidazole, tinidazole, paromomycin, tetracycline, erythromycin. Okay, then the third category is systemic amebicides. आता luminal म्हणजे intestinal amoebiasis समजा ट्रीट झालं नाही तर ते कुठे मायग्रेट होणार, जसं की मी तुम्हाला सांगितलं, इट इज गोइंग टू मायग्रेट इन द lungs, in the kidneys, in the gallbladder. Okay, so in the nervous system also it can go. So these are what is called systemic amebicides, are used to treat such extraintestinal amoebiasis. Examples like metronidazole, tinidazole, and emetin. These are the systemic amebicides. The first drug is diloxanide furoate. It is less water soluble, used in the form of ester. आता हे जे structure तुम्हाला दिसतंय, it is a furoate ester, right? Why? Because it is a prodrug. Ester, when it is taken, ester drug, when it is taken into the body, because of the abundance of esterases enzyme present in the body, this drug is going to be hydrolyzed by esterases enzymes, and it will give the active drug. Okay, so it is going to hydrolyze to diloxanide in the GIT, and it will exert its action as a luminal amebicide. So mechanism of action is not clear, but it is still thought to inhibit or interfere with the protein synthesis and some non-specific enzymes of protozoa. This is the IUPAC name and structure of the diloxanide furoate drug. So it is a furoate ester of 2,2 dash. तर इथे काय 1 फर्स्ट कार्बन आहे आणि हा 2 ॲरो जिथे दाखवते मी. सो 1 and 2 सेकंड कार्बनला 2 क्लोरो ग्रुप्स आहे. सो 2 डायक्लोरो. Then this is 1 dash, 2 dash, 3 dash, and 4 dash. At 4 dash position, we are having some hydroxyl group. That hydrogen of hydroxyl group is substituted by the furoate ester, right? So 4 dash hydroxy N methyl. नायट्रोजन वर मिथिल आहे म्हणून आपण काय लिहिलंय, capital N methyl, and this is actually acetanilide. Acetanilide means what? One benzene ring, NHCOCH3, right? So COCH3 ला कन्वर्ट केलंय CHCl2 मध्ये आणि NH ला केला आहे मिथिल मध्ये, N मिथिल मध्ये. So N methyl acetanilide is there, and this is the whole substitution on it. So the parent molecule is acetanilide. Second drug is for 8-hydroxyquinolines, which are again luminal amebicides. These are basically the halogenated derivatives which are used to treat both acute and chronic amoebiasis, but not extraintestinal. Okay, so it is effective only in the lumen of the intestine. Luminal आहे हे. Neuropathy. The side effect of these 8-hydroxyquinolines is that it can cause neuropathy, means some abnormal changes in the nervous systems. Okay, and that is why it is not using traveler's diarrhea. Now you may wonder what is traveler's diarrhea. See, some people, they have the anxiety that when they travel, they have the feeling of defecation. Okay, ज्याला आपण म्हणतो संडासला लागणे. Okay, so these people who are traveling, they have that feeling. So that feeling is exaggerated by taking the 8-hydroxyquinolines. तर अशा पेशंटमध्ये ज्यांना ऑलरेडी ट्रॅव्हलर्स डायरियामध्ये ते असतात, त्या पेशंट्सला 8-hydroxyquinolines are never given. Okay, mechanism of action: kills by chelating the ferrous ions which are essential for protozoal metabolism. आता अमिबामध्ये आपण बघितलं की रेड सेल्स असतात. दॅट रेड सेल्स इन द अमिबा, दे हॅव द फेरस आयन्स. सो दिस पर्टिक्युलर 8-hydroxyquinoline drug, it is going to bind to the ferrous ion, and it is going to inhibit the functions of the red blood cells. So they will inhibit the certain enzymes related to DNA replication. Okay, we will continue in a short while.